Welcome, everyone. We'll get started here in just a few minutes, about 4 minutes. I am Julie Melk. I'm the Outreach Manager for Balanced Eating Disorder Treatment Center. As you're logging on, if you are here for performance and perfectionism, eating disorders, and athletes, you are in the right place. We are super excited today to share this conversation with you. And I just want to make note of that. This event in its nature is conversational. So please do take advantage of the chat feature. Please take advantage of the Q&A. We plan to answer any comments or questions that come up in live real time. We want this conversation to be dynamic, not only amongst the panelists and myself, but between the audience and the panelists, just as though we were in a room together talking about it. So I'd love to hear where people are chiming in from today. I'd love to know perhaps what profession you're part of, if that's what drew you to this conversation. What did draw you to this conversation? What are you looking to get out of it? Maybe you're a parent, maybe you're an athlete yourself. So share with us your intention for being here so we can make sure to hit on that. Lebanon, hello, and welcome, K Fitness from Lebanon, your personal trainer working with a team of dietitians. Wonderful. Thank you so much for being here. How did you hear about the event? I'd love to know. Okay, a psychologist sent you the link. Yeah, that's the incredible thing of a giant network, right? And digital era, being able to share globally. So we're glad you're here. Thank you for being here. Welcome, Rhode Island Children's Hospital psychologist. We also have a clinical psychologist from UAE. Feel free to share if there's any key elements that you want to draw forth from this conversation. I mentioned before, but I see people continuing to add into the audience that we would like you to put into the chat and the Q&A when questions and comments come up for you in real time. We'll field those and answer them for you in real time, so we don't have to bank them and wait till the end. And we can make this more of a big discussion, not only amongst the panelists and myself, but with you as well. So I am Julie Melk, and I am the Outreach Manager at Balanced Eating Disorder Treatment Center, and your host today for this really fruitful and valuable conversation called Performance and Perfectionism, Athletes and Eating Disorders. We welcome you, and I want to mention the sort of overarching flow of how this conversation will go today. I'll be sure to introduce our panelists, and then we'll talk about why we're here today. We'll hit on the objectives that we'd like you to learn, and please feel free to put in any objectives for your reason for being here into the chat or the Q&A. And then we're going to dive into the uniqueness, of course, of athletes and eating disorders and what's specific to that. From that part of the conversation, we'll talk, of course, about what are warning signs, what are risk factors, what does treatment look like, does training and recovery coexist? And of course, are there any preventative measures that we can provide you along with resources to help reduce the risk or help intervene perhaps with someone today? So let's talk about Balance. Balance, we are an eating disorder treatment center, a premier eating disorder treatment center located in New York City. And we offer boutique outpatient treatment options using evidence-based practices. I'll talk a little bit more about Balance towards the end of our conversation. Let's get into who is here with me today. So I have Blake Bittle, the Director of Nutrition Services at Balance. Blake, will you give a wave or say hello?
Hi, everyone.
Hi. Blake is a weight-inclusive, healthy at every size informed registered dietitian nutritionist. Blake employs a non-diet and all foods fit approach to assist clients in rediscovering their internal cues and help them make peace with food and eating. Thanks for being here, Blake. I also have Becca McConville. Hi, Becca. Welcome.
Thanks for having me.
Yeah, we're so happy you're here. Becca's a sports nutritionist and eating disorder specialist, and she's an eating disorder dietitian supervisor. In addition to her private practice called Renourish, she has been a consultant to the University of Missouri, Kansas Athletics Department, the Kansas City Ballet, and she's even worked with the Kansas City Chiefs. Becca is the author of Finding Your Sweet Spot. Thanks for being here, Becca. And then I have Dr. Kate Bennett, and Kate is the founder of Athlete Insight. She's a clinical sports psychologist, author, and speaker. As a former athletic trainer, cycling coach, and two-time national track cycling champion, she combines her athletic experiences with her clinical expertise to treat athletes with eating disorders in her private practice, Athlete Insight. Dr. Kate Bennett is the author of Treating Athletes and Eating Disorders. Thanks for being here, Kate.
Thanks for having me.
Yeah. And of course, we have Samantha Livingstone. Samantha, give a wave. Hi. Samantha's here with us. She's an Olympic gold medalist and performance consultant. Samantha was a member of the U.S. national team, the U.S. Pan Pacific team, and the 2000 U.S. Olympic team. Samantha founded Livingstone High Performance and the Whole Athlete Initiative in response to the mental health crisis impacting adolescents globally. LHP supports organizations, teams, and individuals to elevate mental health and improve performance. Thanks for being here, Samantha.
I'm so grateful we're having this conversation and to be included. So thank you.
I want to mention that at the end of this conversation, we'll provide a lot more information about these resources and the incredible books and organization that Sam has. And so everyone will talk about those resources as well too, to give you more idea of what you can draw from them and where you can find them. As I mentioned, am Julie Melk, and I'm the outreach manager for Balance. And as part of the Balance mission to support professional and client audiences through education and awareness, I organize collaborative conversations among experts in the field of eating disorders and mental health. And I am so happy to be here because I know I'm going to learn a lot. So I want to list our objectives today. We will understand the uniqueness of eating disorders in athletes. We'll identify signs, risk, warning indicators of eating disorders and the long-term effects that they can have on athletes. And we'll show how recovery and an athlete's identity can coexist. And then we'll lead you to some preventative measures to start to reduce risk and increase safety. So Kate, will you kick us off with why are we here today? What is the relevancy of this conversation? And, is there urgency around having it? Yeah.
Yes, absolutely. So why it matters. When we think about eating disorders in athletes, a couple of things need to be established. One, we know that athletes, they experience eating disorders at the same prevalence rate of their non-athlete peers. So there used to be a belief or an assumption that because athletes have more positive, I would say, learned characteristics and traits through failure in sport and leadership in sport, that they were, I would say, not quite immune, but they had higher levels of protective factors preventing them from developing an eating disorder. However, we know that athletes develop eating disorders as commonly as their age group non-athlete peers. And within that, we know that because athletes exist in sport culture, and sport culture normalizes a lot of disordered eating behaviors, oftentimes the identification of an athlete and their eating disorder actually occurs pretty late. And so often we see that athletes who have eating disorders are sicker. They have higher levels of psychological disturbance. They have more medical complications because sport culture normalizes so many of the red flags with regards to eating disorder identification. An example could be amenorrhea. In a female athlete, we often realize or think about amenorrhea as a common occurrence, especially for endurance athletes. And so instead of thinking about, oh, this might be leading to REDS or this might be a sign of an eating disorder, we often overlook it and think of it as a normalized experience for the female athlete, which means she is sicker when she is identified. And that means that her treatment and her recovery is going to be a bit more challenging than somebody who is identified earlier on. And then lastly, it's really important to realize that with eating disorders, and this isn't athlete specific, there is no athlete specific research on this, but we know with eating disorders in general, there's an elevated risk of suicidality. We know that people who have eating disorders are more likely to attempt suicide as well as complete suicide. And so we're not even thinking just about how do we get the athlete back into sport, but we're thinking about long-term life and well-being for these athletes. And so, early detection matters. It helps us with the course of treatment, early intervention, both from the psychological perspective as well as the medical complications perspective. And I used to go to talks all the time, and they say you treat an athlete just like a non-athlete, and that's not true. We treat athletes differently. We have similar goals with regards to wanting to normalize their relationship with food and body and exercise and establish healthy coping skills. But we also have to learn how to embrace the athlete culture to really be able to relate to these athletes and support them in their health.
Thank you, Kate. That was tremendously comprehensive.
Yeah, so I think coming from Balance, I wanted to highlight that we have these professionals here, right, to help us to engage in a conversation about this all or nothing approach that sometimes is taken, right? Someone saying like, I can't engage in my sport, or I need to engage in my sport, and going through recovery will not allow me to do so. So if anyone has questions specifically relating to that or how to support your clients, please feel free to ask.
Thanks, Blake. That's really important too. Moving into eating disorders, what are they? What are the myths and facts? Becca, I'd love for you to take this on. What is an eating disorder? Of course, we have the DSM definition here, but what would you say in your terms is an eating disorder?
Yeah, I mean, we have the traditional definition that you can look up in the DSM-5, but when you get down to the behaviors, I often say I don't treat a diagnosis, I treat the behaviors. And there's this collision between the athlete and its culture, and then the athlete in our day-to-day culture. And many times those behaviors overlap. And so it's addressing, is it because of their sport demands? For example, binge eating tends to get looked over. And I had a client the other day where when she was shocked to find out she needed probably 2,500 to 3,000 calories, then no wonder at the end of the day, she's starving and needs more calories to be able to meet her energy needs. A lot of times too, there's the pressure around lighter and leaner means faster. And so they feel like they have to be restrictive in their eating pattern to have that performance enhancement, when ultimately that doesn't necessarily lead to that. A lot of times we see more injuries as well. So when I work with athletes, I look at the function of that behavior around food, never wanting to stereotype what that was like for them, and being able to see how nutrition messages might impact that. So I always say at heart, I'm a dietitian, right? So I believe in the power of food and I believe in the power of nourishment. But I also know athletes tend to have a double-edged sword where they have those characteristics that make them so high achieving, but it also can go to the other realm. And I know Samantha and I have talked about this where we joke about perfectionism on the plate, how all of a sudden now that just becomes so overwhelming and over controlling to where now it's destructive rather than protective. So I'd love if Samantha could kind of share her experience where an innocent start with exploring nutrition end up kind of taking over.
Thanks, Becca. I love listening. I just love being part of this conversation and learning too, like what you just said about the function of the behavior and getting underneath the behavior and is in like that, what's driving it, what's driving this driving. So someone that, has worked to put down the armor of perfection, and that was critical for my healing from an eating disorder. It's been over 20 years in recovery now. That what was driving what started out as this desire to see how far I could go in my sport. And at first it was like gymnastics. I stand almost 6 feet tall. Then it was soccer. And then it became swimming. And so the sport was the vehicle to tap into this magic that's in us. And along the way, you layer in the life experiences of growing up in a home with trauma. And then you have more trauma from the coach environment that I was in, and a lot of other pieces to my story that striving became a place where it was no longer driven by wonder and curiosity in its entirety, but it started to be driven by this place of needing to using sports and then ultimately food to try to feel like I was enough. I mean, that's really like, that was, so that I just really appreciate the way that you eloquently talk about how you look at the behaviors and the function underneath and leaning in with curiosity to get underneath the surface. So yeah, I could share more in a little bit as we move into the misconceptions around
what an eating disorder is not.
Mm-hmm.
So anything else from the panel on what an eating disorder is, a clear identifier, Blake or Kate, that you wanted to draw forth?
Yeah, I definitely appreciate Samantha sharing her lived experience and identifying those few different factors that you can look back and say, okay, this was developing. We can see that that was all happening at the same time or in continuity of each other. Because we think of eating disorders as like a biopsychosocial illness, right? For anyone who's tuning in and might not know too much about how they develop. There's the genetic component or the neurobiological component that occurs within the brain, and then the psychological component where someone is receiving a benefit, right, like function of the behavior from these behaviors, like the mental and emotional benefits, and also mental and emotional challenges the person is experiencing. And then the social and interpersonal interactions that might influence the eating disorder, right? So it's continuing on those dynamics that started maybe with the trauma in the home, or started maybe even before then, started with some personality components. And just highlighting that eating disorders are such a wide spectrum, right? We have the disordered eating all the way over here, which is actually really common in athletes, as I'm sure the three of you can speak to even more, with athletes maybe overfueling in some components or underfueling in some components, and taking on those myths and false food beliefs that are sometimes really, really common in the industry. And then we'll go all the way on the other end to like a severe clinical eating disorder that might need inpatient or residential treatment, which is what most people I think of, right, when they think of an eating disorder. So part of what we want to accomplish here today in advocacy is early detection and working with coaches, working with individuals to recognize when those warning signs come up.
Thank you, Blake. Yeah. Sometimes, it's always been easier for me to start with like, well, what is it not, right? So Sam, I want to just circle back to you and talk about what are some common misconceptions around eating disorders?
Yeah. And I like that what was mentioned already, which is performance, right? So I'll mention a few and share little nuggets from my journey and my experience, and then toss it to the team so you can help me with the rest of them. But the first one is that if an athlete's performing, they must be okay, right? And I think that Dr. Bennett mentioned that. And I was well on my way to a really dark space. And so that continuum that you mentioned, Blake, I appreciate that also, because part of my being able to step into the space of recovery required me to actually identify what I was like, name what I was navigating. And for a long time, I'm like, I'm not that, I don't fit this, like checklist of boxes. And so when I look at my logbooks from the Olympics, I was at the Olympics, standing on top of the Olympic podium at the height of my career, and internally was really struggling. And so that for a long time, post that moment, I was hesitant to share it because I felt like the narrative was going to be that, oh, that got you there, right? That this was aiding your performance in some capacity. And it was a nutritionist who I worked with in my healing journey. It's like looking at the logbook and saying, here's your, what started out becoming, like a log to train, track tempo and pacing and sets, and, became over the course of a 2-year period of leading up to the Olympics, it morphed from training sets taking up the entire page to food and the inner critic's words just dumped on that page. And so looking at that, and then, having the nutritionist chime in with what you've just shared with your client, Becca, right? Of like, what could have been if you had fueled properly. And I had never in my, never had I thought about, whoa, what could have been? Like the narrative that I think can permeate is like, oh, that's what got you there. Like this was just a necessary requirement in order for you to get to that level. So that myth being as an athlete's performing, that they must be okay. And the second one is that it's a choice, that having an eating disorder, navigating that space is a choice. And the best way that I can describe it in my experience is that you're like, your car's like, this is our life and we're driving, and our truest selves in the driver's seat. It's like you get booted out of that driver's seat and your car is hijacked, and you're driven by these parts of you inside that, right, maybe think they're serving you in some capacity, but are really driving you darker and darker into the depths of pain. And that not a choice piece was a slide from, pinpointing. I've shared some parts of my story, and it's like this massive puzzle piece that I think years later, am piecing together how our lived experiences, how we internalize that, right? All of the parts that Blake just mentioned, like that, how they all blend together to form our reality. And I had, in that 2-year period that I mentioned, where the logbook started to shift, suffered an injury to my shoulder. And so my sport was swimming. You need your shoulders to be healthy to swim. And that lack of control that I felt, I started to move toward food as a way to try to satiate that need to control. And that injury, right, started that, was kind of this catalyst moment starting me down that path, and which led to, you mentioned, Dr. Bennett, suicidal ideation. So that was part of my journey, which ended up, not in a navigating not just an eating disorder, but clinical depression and suicidal ideation before I got help. So that idea that it's a choice, the best way that I can describe it is like you're in the back seat and there's this part of you that's driving. And I think at the core, before I got help, even though I acted like as an athlete, I have this Olympic gold medal and this title, like I don't need help, like help's weak. Like I can't let people know that I need that. I'm supposed to be a certain way. I felt like an imposter, where it's like the truest self inside of me wanted help. And I think that idea that it's a choice, like if you're needing help and skills and support to be empowered to get back into that driver's seat and heal. And then the other pieces I think mentioned a little bit, but like looking a certain way or fitting a checklist of, anorexia, like that was what I would go to. And I'm like, I'm not this, so I don't have a problem. Or that it's only a woman thing, like this is only a female thing, or it's gender specific. So so I'm so grateful for this conversation, because I think this is so needed in the space to flush this out. So I'll toss it to the rest of the team to chime in with places that I may have missed.
Unmute Kate.
You're muted.
Thank you.
All right, there we go. So I would just love to piggyback off that idea that eating disorders are not a choice. Within that, we know that there's this, as Blake actually mentioned a few slides ago, there's this neurobiological component. And so first of all, nobody ever wakes up and says, today I'm going to develop an eating disorder, right? It starts with small change. Maybe I want to optimize my nutrition so I perform better, or maybe I want to lose a little bit of weight so that I can perform better, or maybe I want to do both. Or maybe I'm going to exercise more because that's going to improve my performance. And so it's never a choice if I'm going to develop an eating disorder. It's always a choice of how can I improve my nutrition, or how can I change my exercise? How can I change my body to be a stronger, more competitive athlete? And of course, there's a whole coping piece too of going through, a life trauma or, some major life transition that can lead to these behaviors as well. But within that, it's not a choice. And I think so often we stigmatize athletes and individuals who have eating disorders of like, just choose to eat more, right? Just eat more. But the reality, or stop purging or stop exercising so much, right? Just stop. But the reality is with this neurobiological component, we know that doing the thing that we're asking them to do, so eating more or exercising less, weighing themselves less frequently, whatever it is, we know that that increases their anxiety. And so while we're thinking like this is the really common, obvious answer, these individuals who are suffering with eating disorders are experiencing excruciating anxiety. And then there's a lot of shame of, why can't I do this thing that seems so simple that everyone's telling me to do? But my brain is hijacked with anxiety and fear and trepidation, and that makes this really, really difficult. And so when I think about working with athletes and eating disorders, whether it's you as a coach identifying, or a parent or physician, all the way up through the treatment team, right? Having a lot of empathy and compassion for how difficult it is to change the behavior and do something that is so normal for those of us who have healthy relationships with food and exercise. And then piggybacking off what Samantha said with regards to looking at that list of anorexia and not checking the box, there is this thing called atypical anorexia. And we know that atypical anorexia exists in people who maybe have a larger than quote unquote ideal body size or shape for their sport. And so what they do is they really work on exercise and they really hone in nutrition to get to what seems like a more ideal body for their sport, but they don't seem underweight or they don't seem malnourished. And so we overlook them. And these people often experience a lot of shame, or they think they don't really have a problem because they don't look like they have an eating disorder. And so realizing that when we're with our athletes and when we're scanning and assessing their health, they don't have to look a certain way. And atypical anorexia speaks to that anybody can have really serious medical complications. In fact, we know that people with atypical anorexia can be as medically compromised compared to their counterparts who have typical anorexia, the more obvious anorexia to the naked eye. And so really just being aware of that fact that you don't look a certain way when you have an eating disorder.
I would even piggyback off that, Kate, and say the clients that I've worked with typically or historically have been more medically compromised because of the weight stigma, that they have not been as monitored, right? Or as flagged. The red flags are not visible to the naked eye, the untrained eye, which is why we are talking so much about behavioral red flag. We'll be talking so much about behavioral red flags later on in this panel.
Yeah, thank you. Sam, I just want to go back a moment and say thank you so much for sharing your personal stories. I think that was deeply informative and powerful. I had chills knowing what was running through you when you were at your so-called peak moment, right? At least viewed societally. We do have something in the chat, something in the Q&A. So Dina's raised her hand and she put in the chat, good afternoon. I hear concerns from students about the amount of extensive training during practice. I wonder how common this experience is and if that contributes to eating disorders.
I'm going to let Kate speak to this first and then I'll chime in.
Okay. Yeah, so without numbers, it's hard to speak specifically to it. I do know that when I think about coaches, I don't even know what level we're speaking to, whether NCAA, high school student athlete or beyond. But I know that there are a lot of rigorous demands of athletes, and especially student athletes, NCAA athletes. And so I could definitely call it something. Okay, thank you. So I know that these student athletes, they have really busy lives. They're in class and then they have these morning workouts and they have afternoon workouts and they certainly have, really high intensity workouts. And so I think there's two problems here. One is the demands of the student athlete, but more importantly, the lack of time to recover, right? And so maybe if they weren't a student and they were just an athlete competing at this level, it wouldn't feel so overwhelming. But because they also have academics on top of athletics, I agree that oftentimes we're asking our student athletes to maybe train beyond what they are capable of managing in their day-to-day life as a student as well. So this comes back to, really the big question is, how do we shift sport culture? How do we change sport culture? And when coaches, their livelihood is on the line, right? Coaches, NCAA coaches, they get their paycheck from winning, and they win by having the athletes perform at the highest level possible. So I think there's a huge cultural problem there too with regards to what we're asking of our student athletes, but it goes upwards with regards to winning and paychecks and job security that influence this as well. So if a student athlete came to me and said, hey, I feel overtrained and under recovered, I would really work with them to find balance. How do we find balance in this? Can we talk to your coach? Would your coach be receptive to maybe giving you an extra rest day during exam week if you're feeling overextended and under recovered? And so I think it's each individual athlete helping them learn how to structure their week so that they have time for recovery, and communicating with their coaches if they feel like they're not responding to the training because they're under recovered.
And if I could add to that, I ask a simple question. what activity do you do outside of what is structured by your coaches and your athletic training staff, strength and conditioning coaches? That will usually tell the behavioral piece of it. And I'll put a plug in for Kate's book. She has a fantastic chart that talks about the athlete that is driven versus behaviors that are destructive. And so they can see if that training and activity piece is crossing over into the destructive behavior, and then how we can work around that, work with it.
Thank you. Yeah, go ahead, Blake.
A really good point, Becca, about doing activity outside of what is structured by your coach or like approved by your coach if we're working with somebody who's already in recovery. Because we do always or frequently say that eating disorders thrive in secrecy or isolation, right? So if someone's doing activities alone, but they work within a team sport or engage in a team sport, that typically is a red flag for me too, right? Thinking about how can we mitigate the things that you're doing that maybe the eating disorder is thriving off of because they're secret.
Thank you. We have another couple questions from K Fitness, and I think it taps into how does an eating disorder develop? So the first question is, are the exact neurobiological mechanisms underlying eating disorders fully understood? The second part of the question is, so can we say it's genetic? Research has also identified genetic factors that increase an individual's susceptibility to developing an eating disorder, Studies have found that certain genes may be associated with increased risk for anorexia nervosa, bulimia nervosa, and other eating disorders. So do we know the neurobiological mechanisms? Is it genetic? Who would like to start with that? Kate?
Sure, I would happy to jump in. So my answer is yes and no. I think there's a little bit of evidence to support it and then a lack of evidence to totally answer your question. There's a lot of neuropsych evidence coming out. So brain scans where we're starting to understand what happens to the brain when it has an eating disorder. So we have brain scans of individuals with anorexia nervosa. We have brain scans of people with binge eating disorder. So we're starting to understand the brain's activity when somebody has an eating disorder. But I don't know that we've ever had a scan or a research study that examines like what happens as the brain's developing the eating disorder. So, I think it really comes into that perfect storm, which I agree, Julie, is the slide of how does it happen? And it really is a perfect storm. It's oftentimes many factors coming together where somebody is just looking for perhaps a bit of control or something that they can manage in their life that feels like they've got some decision in it. And so when we think about eating disorders, there is a genetic component. We know that somebody who has a parent or family member with a previous experience of an eating disorder or previous diagnosis of an eating disorder has an increased risk of developing that. But it comes down to nature or nurture, right? We know that genetics play a part, but then also we know that kids learn behaviors from their parents. And so perhaps there is a parent who went through an eating disorder when they were in college and they're in a okay enough place, but they're still pretty rigid and they eat really clean. And so the kid's starting to develop relationship with food about good food and bad food that contributes to this perfect storm. And then maybe something like COVID happens and all of a sudden my sport is taken away from me. Mm-hmm. And so now I've got all this free time and we've got social media telling us to use this to make ourselves the best version of ourselves we can ever be, right? So now I'm working out twice a day because I don't have a coach programming my workouts. And we actually, one of the risk factors for athletes developing eating disorders is being out of seasonality, because in season, they've got coaches and they've got athletic trainers and they've got everyone watching over them. And then they go in off season and this is when they can do whatever they want. Nobody's watching over them. Nobody's tracking their exercise. So it's this perfect storm, but going back to the genetics, in the activity of the brain, I think we're starting to understand it, but there's not a whole lot of information with regards to how do they develop from that neuropsych perspective. We just know that genetics is a risk factor, and we know that we're learning how the brain operates under an eating disorder.
And if I could add one tool or resource is I've enjoyed Dr. Laura Hill's temperate-based traits. I guess you call it toolbox. And so using some of those traits that we see in our particular athletes has been helpful in how to guide them through recovery and also get an understanding of how their brain functions. As Samantha, you always talk about like taking those parts, but then putting them together in that whole self. Like, how can we now take those to make it for good? So.
Some genetic research that's semi-recent that I'm really excited about is that they were able to identify that particular genes that are associated with underfueling or undernourishment, right, that then kind of pop up if someone has been dieting or has not been receiving adequate nourishment, whether it's because of food insecurity or illness or any other host of reasons. I think, correct me if I'm wrong, but in my opinion, that kind of puts athletes at an increased susceptibility, because if you're exercising or training without adequate fueling, the body might be in a state of undernourishment, right? Increasing the chances of an eating disorder to develop. But I want to also flag that for the longest time, we were not researching other eating disorders besides anorexia nervosa. So there's a lot of research that's needed and is starting to come out more and more now. But there is definitely a lack in certain areas.
Yeah, I think this is starting to already naturally segue into what are the warning signs. What are some of the things we're seeing, Samantha, in an athlete with an eating disorder in terms of either behavior or physical observations?
So I can speak to, I'll come here speaking from my experience. I love being surrounded by experts in the field. I would say, I mean, if you were watching, if I go back and watch it, and even now, I would, so if I go back and look at myself and reflect on my journey, and now in my role as consultant and mentor, looking for signs and symptoms, right? Like things that would be like little red flags for me is the rigidness. Like that rigidness is like the cognitive distortions, or we call them thinking errors in my world, around like all or nothing and good and bad. And when we're locked into that, it's an easy slide to that space of seeing food as good and bad, right? And that all or nothing. And then that almost this inability, or not having the skills yet to see themselves as separate from what they do. So that is a warning sign, and it can manifest as an eating disorder, or maybe it can pop in a different direction. But I think that that's something to pay attention to, is when there's no separation between self. So like seeing myself as a swimmer. So when things are going well, like things are going well and I feel good, but when I don't perform well, like I feel bad. So that kicks up the shame, right? And so being able to have a solid identity of who we are in the world, separate from sport, right? That we are athletes, human beings who are striving through sport, is so someone who is, not handling the highs and the lows that are natural when we're striving for excellence in anything, having a more difficult time with that. And then seeing the world in this all or nothing lens, or that really, like if they're verbalizing that inner critic talk about themselves, other things, standing in front of the mirror for a really long time, that conversation that is highly critical of themselves, self-deprecating, and then also, hiding their bodies and what their body looks like, maybe not eating at tables. Like I can go back now, years later, after we're no longer in the environment, but at the village, next side by side with other Olympians, there were others who were my teammates. We were sitting having meals together, who we were all struggling with this underlying eating disorder, and no one was talking about it, and we were suffering silently side by side. So sometimes I don't know if this is incorrect, when maybe there's things that you might not notice, right? There's, I know that when I was at my sickest, I did my best to hide as much as I could from the people that love me.
And I'll speak to the physical piece. There's so many parts of the athletic body and functions that get normalized that shouldn't be. We hear that all the time with low heart rate. Oh, that should be an athletic heart. Well, not necessarily. My stomach hurts when I try to eat anything after training. Or I can't eat anything before I go on. No, that's actually not, that's not a function of it as well. So I really go through, Nikki Keys has a beautiful diagram with reds. And so we go anywhere from digestion to your heart, to your immune system. I just had somebody that's doing some pretty intensive Ironman training, and he felt like he needed to cut back on his carbohydrates. And next thing you know, he's got an upper respiratory infection. So we talk about the cycle of sickness that happens with training that, he alludes to, okay, it's just because of the volume of my training. Well, no, it doesn't have to be. And I think we see that all the time, or that blanket comes up just because you're an athlete, and we can fill in the blank. And I really try to provide the research and science behind it does not have to be that way. And I really want to see a generation of resilient athletes that can put in consistent training to get the outcomes. We see more PRs, we see more, successful seasons, and not be, well, every runner gets a stress fracture, so I was due one. It doesn't have to be that way.
Fascinating. Thank you, Sam. Back up.
Julie, I'd like to jump in real quick. So Sam talked about it a little bit, but from the psychological perspective, that rigidity. So maybe we look at athletes, or an athlete says, I eat clean. And, within clean eating, to the extent that I skip family birthday parties because I don't want to be around the pizza and cake that's being served, or skipping out on a team dinner because I don't feel like they'll serve the food that I want. So there's a rigidity, but also an avoidance to certain situations that make me feel like my choices will be compromised or perhaps exposed. And then also for people who have younger kids, I've worked with male athletes as young as 11 who have anorexia. And we start to see emotional outbursts, right? So maybe we're on a family road trip and we have to stop at McDonald's because it's the only restaurant within 300 miles of where we are in the middle of nowhere. And there's huge emotional outburst of, I can't eat here, I don't want to eat here. And starting to realize that that's not just a picky child, but perhaps there's something psychological going underneath with regards to their relationship to their food and their body. So really looking for emotional reactivity, avoidance, rigidity within their food choices, and realizing that those are signs of serious psychological illnesses.
Super helpful. Thanks, Kate. Blake?
I'm wondering if whoever wants to take this question, I think all three of you would be well equipped, for coaches, trainers, people who are engaging maybe within the team or within a practicing facility. What are things that you would look out for within a group that would tick off, okay, maybe I should monitor some individuals, or maybe I should pay a little bit closer attention to my team?
Yeah. I'll share a story. So my husband's a strength and conditioning coach, and he took I certified people in mental health first aid. So he came in like kind of as a favor, but also because he was curious to learn. And literally it just helps you to attune to like behavior. That's like a change in behavior, I guess is where I'm going with this. And so there was an athlete who came in, and the color of their skin was just a little bit different. They were just like a little bit lethargic, right? So like, and you just noticed and leaning in. So I think paying attention to what we're noticing, those maybe changes in behavior or change in energy levels, and leaning in and noticing, becoming an equipped noticer, right? Leaning into what we're noticing with curiosity and not judgment, not making assumptions, and not feeling like we have to diagnose either, especially for those of us who aren't mental health professionals, right?
I know, Kate, you want to add, then I'll circle back.
Sure. Yeah, I was thinking, again, I kind of spoke about that behavioral piece of, are they joining in on team meals? Do they jet off real quickly after the meal? I would look for, somebody mentioned this earlier, but even like on a rest day, are they reporting that they went out for an easy run? I think it's so easy to get focused on the food piece, but exercise is definitely a big piece of that too. Are they not recovering from workouts? And why might that be? Recurring stress fractures or injuries or illnesses? I think these are all indicators for coaches, athletic trainers, to be able to just have that red flag of, like Samantha said, that curiosity of like, what's going on? We would expect our athletes psychologically and physically to be more resilient. And so let's dig deeper and see what's going on with regards to their physical and psychological health.
And I think too, the coaches and even the captains on a team can help set some expectation and guidelines where there isn't negative talk around food. I had to plot, I can't even take credit for this. I had a student athlete that I worked with that had worked really hard on her recovery. And so she took intuitive eating principles and put them in the locker room. And then it was like an open discussion around the team, like, hey, let's honor our hunger and go get our recovery snack, or let's honor our health and watch movies during rest day. And it was amazing to see a team that had been pretty riddled with eating disorders start to shift the culture by within. And I think that's really where we can see some power with our coaching and athletes.
That's incredible. It's, leveraging the peer support, right? And yeah, teammate to teammate, like let's we're in this together. Let's do this together. I'd love to read what's in the chat from K Fitness. As a certified trainer, I usually look for quick changes in weight and body composition, obsessive behavior around food and exercise, distorted body images, abnormal eating habits. But the only person able to actually identify is the sports psychologist present. We just red flagged them for her. So that actually brings us into what do we do in terms of intervention and detection. Just have to move a little bit here. My screen. I'd love to start to clarify what helpful intervention looks like, because I think just knowing outside of this conversation, when you see something and want to say something that has emotional weight to it, it can kind of fall one or two ways of the fulcrum, right? It can help, or it may just do the opposite and actually disconnect further. So what does helpful intervention look like? Who's involved? Is there preparation before the intervention? What are exact things maybe we could say to a person that's been identified? I don't know who wants to start off, so I'm gonna leave it. I'm just gonna put it out there.
I can start before the tagging in of professionals, if that's helpful.
Yes, Sam.
So like speaking to, like coaches, parents, teachers, so front lines, right? We're interacting with athletes. And we notice, so that idea around becoming an equipped noticer, that's what we're doing. I mean, if you're a coach, that's your hat, that's your role. You're constantly watching, you're constantly observing. So paying attention to that. And it starts actually even before you notice that someone may be struggling or navigating a mental health challenge, or is upstream, like what the poster of that team, Becca, that's amazing, right? Having that poster, like the culture. What is the culture? What is the pulse of the culture? Are you building? Is it healthy? Is well-being being honored? Are you checking in to see how someone's doing long before you suspect there's an issue? Like those are important parts and pieces, and that helps to make it not so awkward when we're entering into and approaching someone with our concerns. So I mentioned mental health first aid as it's an international mental health or a public health program. And in that training and curriculum, we use the acronym ALGE. So it stands for constantly assessing, the A, and then approaching. And that approach is important in how we do that mindfully, right? So if we have rapport, being able to have a private conversation to express our concerns, and that listening non-judgmentally, the L, right? So leaning in. And I think the most important part here is to check ourselves. Like, are we the person to have this conversation? Have we challenged the stories that we're telling ourselves? Have we asked ourselves why we think what we're thinking, right? Have we done the rumbling internally before we engage in this conversation with this individual athlete? And if we're not the person, we don't want to disregard what we're noticing, but maybe tag in someone who's a more appropriate fit. So that L of listening non-judgmentally and leaning in. And then what we do from there is give reassurance and support. And so, I can't say, even as someone who's in recovery, I can't say I know exactly what you're going through. And I certainly don't want to lead in and make promises that I can't keep or even, make happen. But being able to say, I see you, I'm with you, here's what I'm noticing, and using those I statements. And then having the ability to tap into resources and encouraging that professional help. So having done the homework, if you're suspecting or seeing something, or even long before that, collecting resources like Balance, right? Like the people that are part of this panel, having those compiled so that they're at the ready when you need to have these conversations, and then can help walk with them to be the bridge, maybe to set up that first conversation. I would never have gone willingly if, speaking from my own experience, my coach was the one who said, you're going to meet with this guy and you're going to meet every week. And then he was the one who said, we're going to pull in this team around you. And if that hadn't been encouraged and really almost required by my coach, I don't know that I'd be where I am or even here. So being able to be that bridge, but not just say, go do this thing, right? Walking with the person to be able to onboard the help that they're needing. And then what helpful intervention looks like from there, I'll leave it to the experts to speak on that. Yeah.
I'm so glad you could speak to that from a personal lens, Samantha, because I was going to say, what does a helpful intervention not look like? And that would be something along the lines of saying, hey, I think that there's something wrong here. Or I think what I witness most is someone like a coach, parent, family member saying to usually an adolescent, in my personal experience, I noticed that you're not eating so much, like you've got to eat more, still engage in your sport, but you got to eat more, right? You got to increase what you're eating. And then lack of follow through, or they are brought to a doctor who maybe doesn't specialize in eating disorders, and they reiterate maybe a similar message, right? Oh, your heart rate's not that low. Just make sure you're eating more. We'll check back in a couple of months without appropriate referral out. So your coach being able to, like you said, walk with you, I think I agree with you, is that's very, very, very important. Especially because the eating disorder, I like to envision it almost like a virus, like it'll latch on, right? So anything that validates the eating disorder's functioning, it'll grab onto that. If there's a message that's not coming from the treatment team that is the opposite of what they're saying, it just makes it really, really challenging to break through that lens.
And I would just add to that, Blake, with regards to speaking, I love that idea of the curious observer. I always encourage people to use I statements, right? So instead of, hey, you have a problem, right? Because immediately whoever that person is, they're going to be defensive, like, what? I have a problem? You're wrong. But I am really concerned about you. I've noticed you haven't been to team dinners, or I noticed you've been sick almost every week for the past month. Or so using your I statement to create an awareness of, like, I have this problem because I'm worried about you. And what can we do about it? Have you checked in with medical? Or, I've noticed maybe your body's changed a bit, and I'm just really worried about you, and I'd love to get some eyes on you, and here's the referrals. So I think it's so important to come from the I perspective versus the you perspective, because that creates an instant disconnect with whatever athlete you're trying to communicate with.
And if I could add from the medical piece of this, sometimes having systems in place can be really helpful. We talk about that spectrum of disordered eating to eating disorder, depending on where they're at in a university setting or high school or club, is if they've had a stress fracture, they need to go see a dietitian. If they're having trouble with digestive disorders, go see the dietitian. And I joke a lot in my supervision with these dietitians is that's the back door in. We're not calling it disordered eating. We're just saying, like, hey, right now something's going on that taking a look at your nutrition might be of benefit. Then we can get some eyes and ears on them to see if that disordered eating might be causing that. And it catches a whole lot more than waiting till the wheels come off the bus.
I think what I'm hearing from all of you and from all of our perspectives is that intervention is also prevention, and vice versa.
Ashley would like to know, what is a good way to phrase telling someone you've noticed their weight loss without perhaps validating the ED further? Kate, would you like to answer that?
Yeah, so I like I said, I would start with the I statement, but I wouldn't even talk about the body, right? If I've noticed somebody's lost weight, but I'm a coach or an athletic trainer, I'd maybe talk about performance. I would talk about mood if I'm noticing mood or social withdrawal. So I would try to talk around it without having to say your body is different. Because anytime we talk about the body, like I believe it was Blake and Becca just said, right? The more you talk about the body, the more you emphasize whatever the eating disorder is going for, or you give it a seed to grow off of. So I would recommend looking around that to figure out how else can you express concern. I've really noticed that you don't seem as connected to the team anymore. I would really like you to go talk to our sports psych on staff, or younger athletes. I think we have to remember too, high school and middle school age athletes deal with this too. Like, I'm going to give your parents somebody to call to talk to, and I'd really like for you to follow through with them and at least have one session. So I would find other indicators of change in their personality or their performance, and speak to those things, and let the body be the body, and trust the treatment team to be able to address those pieces.
And I want to add one thing, Julie, real quick, that's really important, is a lot of times, and this speaks to in the REDS literature, and I speak to it in my book, and that's actually what prompted me to write it, was I had so many that, matter of fact, may have even gained some weight or were holding at a weight, yet had all these signs of dysfunction. And so we see that metabolic suppression that will happen as a way of the body and the brain trying to protect this low energy. So if we sometimes only go off the visible appearance or their weight, we're going to miss a whole lot of dysfunction that could be going on. Sorry.
No, that was great. That was very helpful to know. Becca, you mentioned REDS a few times. Will you explain what that is for the audience?
Sure. So it's relative energy deficiency in sport. I actually like to refer to it as a deficit. So there is a mismatch between the energy that's coming in versus the energy that's going out. And in the beginning, there may be some changes to the body, but what will end up happening is the body is pretty brilliant. It'll start conserving energy by shutting off the menstrual cycle or sex drive, bone recycling, digestion, and then we start to see that dysfunction that presents. Even cognitively, they'll start to get more stale in their training, or their mood will start to change.
Thank you. Dina,
Julie, could I interject real quick?
Yeah, go ahead.
Just on the REDS piece, there's nowhere else to kind of put this out there, but so often, I think this would maybe be back under sports myths, but so often we think of when a female athlete loses her menstrual cycle that, hey, just put her on oral contraceptives and she'll start to bleed again, and life is good, and I would say in the last 5 or 6 years, we have literature that says that oral contraceptives do not protect bone health. But I still, in the last 2 or 3 years, have NCAA student athletes coming to me saying, hey, I got put on the pill, I'm having a regular cycle, and I think I'm okay. So I really, just for all of those who are listening today, knowing that oral contraceptives are not a solution to protecting bone health. In fact, they create this illusion that my body is healthy, I'm getting a regular menstrual cycle. It's not a cycle, it's a withdrawal bleed once a month. And so athletes don't worry so much about their energy availability and the health of their bodies, because they have this illusion that their body is functioning properly with the oral contraceptives. So meanwhile, they continue to be at that deficit, losing bone mass and having other issues. We also know that irregular menstrual cycles are now correlated with cardiac disease, which is really scary. So there's a lot going on there.
That's a very important piece. So I'm glad you mentioned that, Kate. I'd love to talk about the levels of care, the spectrum. I think sometimes there's a bit of mentality is eating disorder treatment is residential. You go away, you have to stop your life. And in this conversation, obviously, sport, it ends, treatment begins. Blake, will you share with us the whole spectrum of treatment, all the different options, and of course, like, we can start to get into how sport can coexist?
Yeah, absolutely. So as you can see, there's about 5 levels here that do have different, I think, individuations amongst them. Myself, Becca, Kate, we all work at the outpatient treatment level. Clients working at this level are medically stable. They're able to make progress in their recovery. They might be engaging in their sport, but they might not. They might also have additional supports like recovery coaches or one-to-one meal supports at times that are maybe more challenging. And then we have intensive outpatient and partial hospitalization programs. These are the levels of care that Balance offers. So these clients are people who are living at home. They're able to make progress in their recovery living at home, but more structure is required and more monitoring is required to make real progress in their recovery. And structure, I'm specifically highlighting fueling and nutrition in terms of not only just eating regularly, but also challenging false food beliefs, challenging harmful dieting messaging. Those are really done at all levels of care, but I think really intensive, great work is done at IOP and PHP levels. And then moving forward up from there, we see residential treatment and inpatient. If someone is experiencing any symptoms of REDS or any medical instability, we would want to be looking here. If we're noticing hemodynamic instability, such as blood pressure dropping, or we're noticing blood glucose, especially, that's one that really freaks me out, irregular EKGs, we want to be referring to a higher level of care and definitely getting medical on board. That's something that I want to follow up and just wrap up on, is that medical is required at all of these levels of care, especially for an athlete, for all of my eating disorder clients, but especially for an athlete, to really be monitoring vitals, heart rate, bone density, labs, and electrolytes.
Thank you, Blake. It does training stop, right? Does movement stop when you're in treatment? What does that look like? Kate?
Oops, sorry. Go ahead, Kate.
Yeah. So if you're inpatient, yes, you're living in a hospital. So definitely training will stop when you're inpatient. If you're that medically compromised, you can't train, right? Your body can't handle the load or the stress. And so when I think about training with regards to eating disorder recovery and where does it fit in, there's really 3 questions that I'm asking myself. One, is the athlete medically stable? If the athlete's not medically stable, we can't put more stress on their body, right? So we do remove training. And medical stability looks like a lot of things. I'm thinking about heart health, like cardiac health, electrolyte level health. Are they compromised to such an extent that their body can't handle any stress? If they're amenorrheic, that's a different question, right? We're starting to look at what is that balance, and can they get enough calories in to continue weight restoration while training, right? And so it becomes a bit of an equation of, does this support both goals? So the questions are they medically stable? Are they nutritionally compliant? Are they working with their nutritionist, following the recommendations, doing the challenges, improving their energy availability day to day? And then lastly, come from that behavioral psychological perspective, are they compliant with their therapists? Are they working with their therapists to develop new effective ways of coping with distress and emotional challenges? Are they following the treatment recommendations? Are they being honest with the team? Are they secret training outside of what they're reporting us? We'll always know, it's very obvious that the nutrition will tell us whether or not it's supporting. So yes, you can train, I would say, PHP down. But it really comes down to those 3 questions of whether or not they're medically stable, whether or not they're nutritionally compliant, and then lastly, whether or not they're working with their therapist to really make the psychological and emotional gains, as well as the behavioral changes that they need to be making.
Yeah, I always highlight willingness and ability to fuel for the sport. I think willingness is one thing, right? Is someone willing to follow the meal plan or engaging with their dietitian? But then are they able to, right? Somebody might come in and say, I'm really, really motivated to recover. I want to get back to my sport so badly. Depending on how that is set or the emotional difficulty, that might also be something that we monitor before returning to sport. But they might be willing, but not able to, because the eating disorder is really, really challenging, and engaging in a meal plan of a higher level to support the sport doesn't feel doable. Becca, you were going to speak and I jumped in right at that same time.
No, that's okay. That's okay. I'll just add, we don't take a timeout and then draw up 5 different plays. Everybody has to be on the same page. So I'm a big believer in collaboration of care. So if there's any recommendations made, like everybody on the team, if it's an athletic trainer at a school, the therapist, the dietitian, the doctor, whoever else might be responsible, everybody each week is getting that recommendation, so they're not getting conflicting messages that can be confusing, or if they're not being compliant with their care, sometimes that comes to the surface as well. But it's, again, surrounding the whole team around them.
We're right at the top of the hour. I want to make sure we leave our audience with how an athletic department supports recovery and also prevention. If there is any particular measures that an athletic department can take on in terms of harm reduction, right? Or preventing some of the risks. Sam, I know that you shared with us before some personal stories that, you know, may have helped you in your struggles.
Which ones? I know we're tight on time. Yeah, I mean, so my when you were just cueing us, that my first thought went to upstream, that creating healthy, high performing cultures. So like looking at that big picture of what can we be doing to bring in and weave in common language, help our athletes navigate their internal world, understand that their thoughts are thoughts, understand emotions, and start to create this, you know, increase the literacy and helping empower them to navigate what's happening internally, while also supporting the adults through things like these, right? Growing awareness and education. And you know, really, I think training coaches when it comes to challenging what that old school toughness model of like, suck it up and red is bad and all of the things that just continue to get circulated even in 2023, right, in athletic arenas, so that we can start to put down some of the narrative, right, that may be contributing and piling on and driving, so that coaches are equipped to lead the athletes that they are, you know, helping to thrive within sport. So yeah, and the story I think maybe you're sharing or you're asking me to share is about the mirror, like the simplest thing. At our pool, the mirror cut most, I mean, I'm tall, but like almost all of our heads off. So like the mirror was literally doing what then the end internally did, which was see myself in fragmented pieces versus this whole human in this physical body that I was asking to do so much, right? So it was like cutting off your head, so you can't even see your eyes. And then the intensity of staring at your body and overanalyzing, hyperanalyzing. So something as simple as, what is the physical structure of the building, right? The lighting, the mirrors, the things that, you know, what are the messages that maybe that we may be sending, and how can we best support our young people to thrive and be healthy?
Yeah, thank you.
Yeah.
We have some questions I'd like to, of course, get to, and panelists, will you put into the chat? You should have access to the chat, the books that you mentioned in conversation. So if you did mention any or reference any, I should say, throughout our conversation, just so the audience can look those up. But we have a question from Becca. And Becca is a clinical sports psychology PhD student at St. Louis University, working with athletes with eating disorders. And Becca asks, how do you navigate working with athletes, especially women identifying athletes who are in non-lean sports, where muscularity is favored over thin, lean ideals? I see them fighting for the socialized thin ideal while also developing disordered eating around gaining muscle mass. It's tough when most interventions I'm aware of are tailored more for lean sports. It's a great, great question.
I feel like I want to jump through the screen and say that this is like a small little tidbit, but that helping them understand, right? Creating that awareness around what the cultural messages is saying, bringing it into conversation collectively, and that idea that the clothes that we're trying to fit into for years, blaming our bodies that we're not fitting into these clothes versus like the clothes aren't made for these athletic, beautiful, strong, capable bodies, right? So helping them shift by even asking the questions she's asking, but that idea that I feel so passionate about this topic, that the clothes, the ideals of being thin are not, we have to pave new pathways for embracing our bodies and being strong and what's required of that, and that there's no right way to be. So yeah, I'll toss it to the others. I know I'm talking a lot.
I'll just chime in real quick. We know that there is such a thing called it's contextual body image. So I feel one way in my body in sport and one way in my body outside of sport, right? So maybe in my, let's just say rugby players, right? In rugby, I feel strong and powerful, and I use this body to accomplish incredible things. But then I walk off the pitch and I go about my day in town, and I'm on campus and I see all these other thin ideal bodies, right? And that's where I actually start to feel self-conscious or body dissatisfied. So I think one of thing is just to create that awareness of your body. You have different experiences of your body, right? You have different experiences of body image. And then another piece is really, I think, education. Like, what's the thin ideal built upon? And is it, I mean, we know that the thin ideal really comes, out of the 70s, when fashion designers wanted their models to be hangers, literal hangers for their clothes, because they look so great on the hangers. So really giving them some education around thin ideal and systemically, why do we idealize these bodies? So giving them power to reject these cultural values and educating them so they can make informed decisions versus just internalizing messages that are all around them.
I don't know if I can send a clip after the fact, but there's a powerful video where they take 4 women athletes that are in power-based sports, and they actually Photoshop their bodies to be the way that they envision they should look in the thin ideal. And almost all 4 of them, when they saw their Photoshop bodies and the way they thought they should look, were like, ugh, but then I would do horrible in my sport. So it showed just that tug of war between like, wait a minute, maybe now I don't want to have those changes in my body if it means losing my superpowers that I have in my sport.
I think also when a client is presenting in a way that you maybe weren't taught that someone might present, or it doesn't fit the usual mold, you can always bring it back to what are the basics of the eating disorder, what's the function of the behavior. So whether that is someone feeling very focused on gaining muscle or on losing weight, what's the function of that? What does the body mean to this person? What's the valuation of the body? And is there a connection between the mind and the body, right? Because if there isn't, that's going to continue to perpetuate this psychological difficulty. So we can kind of get back to that rather than focusing on, specific interventions.
We have another question in the Q&A. I work at an ED center. Some clients are athletes, some are not into working out at all. Athletes tend to have a keen sensitivity to how their body responds to food and etc. And they tend to have a high degree of resistance to re-nourishing with foods the RDs prescribe, which may be considered unhealthy in their athletic culture and mindset. They really reject any health at every size approach. If these are minors, their parents are involved, and they also tend to be resistant. Staff talk to them as being deep into diet culture. Do you have any recommendations for how to handle this in the treatment setting? Do you think there should be a different approach with athletes?
I feel like I am well equipped to take this one on because you're describing my day-to-day life. It's really challenging, right? When there are, I think something I've noticed and that you're speaking to is that when someone is engaging in sport or engaging in something that further ingrains these beliefs that are already present in our larger society, and their identity goes back to this engagement in the sport, right? So what you're asking them to do is not only reject what they've been taught about food and larger society, but also reject, in their mind, their identity as an athlete. In their mind, this asking them to eat this, like, I don't know, white bagel instead of like a wheat bread might feel as though they are rejecting their ability to perform in their sport. So a lot of education is required, right? And I think we have to take it from a very, very, very like step negative zero perspective and understand that it's going to be a long-term effort. And especially with adolescents, also educating parents, right? But knowing that the child, as they grow up, will be able to develop more and more autonomy in their own relationship with food. So exploring those false food beliefs, exploring the function of the false food beliefs, right, is a big, big, big component. And it might even be connecting with their coach, right? That's something that we do at Balance very frequently when we work with athletes is, okay, what are the origins of these false food beliefs? Have they been reiterated in sport? Can we find some path to healing by providing collaboration? But I have a lot of compassion for that, for the clients and for you. It's a tough situation.
I would just piggyback off that real quickly. I think oftentimes athletes think if I take on and adopt this idea of health at every size, then I'm abandoning my athletic identity. Like the two can't work in harmony together, and helping them to understand, like, the goal is to restore their physical health. So often I think there's a stigma of health at every size means you will be larger than you should be by the time you're done with treatment, right? Like we're trying to over restore you. and helping them to realize that, one, we know that we need your trust and your buy-in. And so we don't want to take your body to a point that it's not healthy for it. We just want to get you to your healthy spot, but also this idea that health at every size and the athletic identity can work together. And I think that's what Blake is saying about the education piece, really helping them to understand that it's not so much about having to let your body, quote unquote, go, but more of just getting your body to its healthy place and understanding that that looks different for everybody.
Right. Absolutely.
If I could add one last piece, I actually want to slightly disagree that I feel like some of my athletes do not have interoceptive awareness. I think they're good at their sport because they can disassociate from what they're feeling in their body. So it is hard for them to experience hunger and fullness. And they may have been at sport in such a young age that they have minimal eating competence. They're told when to go, what to eat, how much to eat. So I think sometimes the beauty is letting them connect with that for the first time and teaching them those skills.
And then I have one last point, and I'll let us move on. I just
And
want
then
to go
Blake
back
will have
because-
one last after that.
Okay, yeah.
Okay. So that other piece about the athletic identity, oftentimes athletes think they have to abandon that piece. But I really harness the power of the athletic identity in my treatment with athletes. And so helping them to understand, if they have this ability to suffer in sport, right? Like they would never raise their hand and say, hey, coach, sorry, I can't do this repeat. It's just too hard for me today. So they have this ability to suffer in sport, and they have this ability to work through hard moments. And so then I take that same experience and I help them live it through recovery. And so I think there's so much power with embracing the athletic identity and the superpowers of the athlete so that they can use those same strengths to push through the hardest moments of recovery.
Yeah, absolutely. I was just going to agree with you, Becca. In my experience working with athletes, especially if they are extremely focused on their narratives around food, the experiences physically of the body are typically not very accessible because they're very disconnected. And it might be something such as like, if, for example, if they are in REDS, right, they might be experiencing gastrointestinal discomfort upon eating. The foods that we're providing for them are ones that they have a narrative around. So it reinforces the eating disorder beliefs. But I was going to say that mind-body connection and working somatically with the clients is something that I really am very excited about. And I like to frame it as like, this is work that you can do to improve your sport performance when you're not physically training. Like, what are the things that we can work on with you? How can we build a psychological skills and body related skills that don't involve physically training? It's not something that you've thought about before, but how can we help your identity in that way? It sometimes helps create some buy-in.
So many golden nuggets. It's really difficult for me to end this conversation. We do have 2 more questions. If everyone wants to hang on and answer these, I would love for that. I do want to respect everyone's time though. One question, and I'd love to hear from Sam on this, does knowing that there's a possibility to stop sport prevent athletes to stop sports, prevent athletes to admit or accept they have an eating disorder? So using that, I guess, as a threat, does that help them recover?
I think that's probably so uniquely individual, right, with the person. So in speaking, what I feel pulled to share here in response to this is helping to connect with the underlying, like, I'm noticing this instead of coming in as like, you're going to lose this, right? That punitive space. I'm noticing this. Let's see how we can help you heal, versus the threat to take away. I don't know I don't know that I can answer this well. I can speak to my experience of if someone had threatened. I mean, I was pulled out of sport because of my shoulder. And because of that forced me into, the coach setting me up with that mentor who's a social worker, who then surrounded me with a team of people to help me with the eating disorder. So I don't know that I can give a great answer. Yeah, I'm sorry on that one. I think it's individual. And I think my philosophy comes from a place of wanting to connect with the human being who's underneath, the human who's striving in sport. And I think the more we can connect with the human and help them understand that their human mind and human body is doing what human minds and human bodies do, and maybe needs a little support to come back to a healthier space. And that this eating disorder is something that is visiting, and there's a path to recovery. that kind of coming from that energy versus coming from another form of control, because that's the thing that, at least for me, was I was feeling like everything was spinning out of control. And so this was the one thing. So if you had tried to come at me to try to control one more thing, I don't know how I would have responded. So yeah, I think at the core, seeing the humans that are underneath and trying to connect with them, and then figuring out, what the next best step is for them.
Thanks, Sam.
Yeah.
Final question. We know that hormonal fluctuations related to the menstrual cycle may play a role in the development of eating disorders. Can birth control disrupt these fluctuations and potentially increase the risk of developing an eating disorder? Is there any correlation or relation between pill and eating disorder?
Not that I know of. I think there needs to be a better understanding of how the hormonal waves that come in a cycle can impact energy level. I know right now that's really popular, like train according to your cycle, but it goes back to what we've been saying, N=1. I think everybody's body is going to respond differently. And then those oral contraceptives or birth control methods can sometimes impact how much hormones are released or the control of hormones, but I have not seen any correlations. I'll put in the chat, Dr. Nikki Key now has Health and Human Performance, a book about endocrinology within sport that's phenomenal. So that would be a good one to read on that. Hormones are a superpower. We should celebrate them.
And I'll just piggyback real quick off Becca. I've seen a lot in my practice that female athletes, they often struggle with body image for specific parts of their cycle, right? So that might perpetuate some disordered eating or reinforce this idea of like, there's something wrong with my body. I feel so bloated or whatever. But similar to Becca, I haven't heard any research around that. I just know anecdotally that a lot of people in my practice struggle with their body image at specific parts of their cycle.
Thank you. Thank you, everyone, for being here. Of course, the amazing panelists that we have and our audience with all of your incredible questions, deep questions. I learned a lot today. This last slide talks a bit more about Balance Services. If you're on your computer, you can just hold up your phone to some of these QR codes. The QR codes are about programs that do adapt to a very hectic lifestyle. And so that's why they're highlighted here at the bottom. But we do have a wide array of services, from larger programs, 30 hours, 15 hours a week in our day, an intensive program, respectively, a Saturday program, a summer adolescent program, meal support, individual nutrition counseling, and then weekly outpatient groups. We'll send information about all of this that was mentioned today in a follow-up email tomorrow. So look for that in your inbox, and have a great weekend, everyone, as well as the recording to this. Thank you so much for being here.